Talk to you today about COVID-19 risk control and with particular reference to personal protective equipment. But I want to use this opportunity to place that into some kind of context really, and where it sits with all the other things you can do to be able to control transmission. So quickly on, I think the logic, first of all, before you get into any kind of consideration about what risk controls to think through and about, you've got to understand the hazard itself. In this case, the biology of the virus. Ask yourself what you're dealing with. You know, this is a microscopic virus. It's carried in minute water droplets. Those water droplets can come from coughing, sneezing, spitting, talking, and indeed from transfer when you're touching contaminated surfaces and such like. So those are really important aspects that we need to think about when we're designing any controls around it. And of course, remember, it is a highly contagious disease. The other thing to think about before you consider your controls is understanding your business context. So who are you? And what do you do? And what do your people do? And who do they do it with? You know, all of those kinds of things. So consider travel to and from work. So how do people move to and from your environment, and where might they pick up the transmission? Public transport is an obvious thing. So can public transport be avoided in some way? Your working environment. So within your working environment, how do people move through it? How do people use it? What kind of work do they undertake when they're there? Who do they meet when they're there? And so on and so forth. Think about congregation points, so things like stairways, lifts, corridors, lobbies, restrooms, canteens, all of those kinds of things need to be thought through in terms of, well, that's where people will come together. So how do we control that kind of an environment? And all of that is in the context of how do you control the exposure of one person to another. So with that kind of logic in mind, understand the biology, understanding the context of our business, then move into thinking about, well, what about the risk controls? So the first thing to identify really is that business risk management controls and occupational safety and health risk management controls are not a million miles away from one another. So in business terms, we talk about risk avoidance, risk reduction, risk transfer, risk retention. Well, actually, the occupational safety and health professional has its own hierarchy of risk controls. So we have elimination and substitution. Effectively, that's risk avoidance. And then we have engineering controls, administrative controls, and PPE, personal protective equipment, which is risk reduction. Now you'll notice on the left-hand side, we've got a grey arrow which says most effective, and down at the bottom, least effective. So where does PPE sit? It sits as least effective. Now why is that? Because there's a whole host of other things that you can do first, which are more effective than providing people with PPE. And let me explain. So first of all, from the point of view of elimination, this is asking questions about how can you avoid people's exposure to the virus. So can you avoid it in full or in part? So ask yourself, you know, are we asking enough people to work from home, for example? Because working from home is a fantastic means of social distancing. And how do we keep social distancing within our own environment? So are we spreading people out over a wider area between the desks and that sort of thing? How do we isolate the vulnerable? So you could argue that furloughing vulnerable people is actually an effective avoidance strategy for transmission of disease to those vulnerable people. Next on the list, we have substitution. Well, it'd be great, wouldn't it, if we could substitute this virus for something less harmful, but that's not going to happen, unfortunately. So we need to move on to risk reduction. So we start with engineering controls. Now, those are physical barriers that enable us to be able to put in place between the hazard and the human. So a classic example of this you'll be familiar with is the Perspex screens in front of cashiers in retail stores. So it protects the cashier from the customer and the customer from the cashier. So that's a classic example of an engineering control. But more than that, you know, there are other engineering controls that you can think about, some of them quite simple. So we've got a piece of research we're about to publish at the Institution of Occupational Safety and Health, albeit about people with viral infections in medical environments, it does teach us a lesson. What we were able to show is that, or the researchers were able to show, is that if you have ventilation pressing down on the, blowing down onto the patient, you actually reduce the viral loading of the environment dramatically, of the atmosphere dramatically, and vastly reduce the likelihood of somebody inhaling contaminated droplets. So we can take that learning, can't we, and we can work with it a little bit. So is it possible for people to do their job outside rather than inside, for example? Or is it as simple as just opening the windows or turning up the ventilation system in your office blocks and what have you, that might actually help? So think about those kinds of things in terms of how can you get a throughput of a breeze? How can you actually move the air around the environment and clean the environment in that way? So that's a couple of examples with engineering controls. Next, we have administrative controls. So from an administrative control point of view, we have such things as, well, there's 5 areas really for you to think about. First of all is job design. So think about where people are working, what they're doing, and why they're doing it that way. So think about double crewing of vehicles, for example. Do you need to double crew, or can you single crew? Can you dedicate a vehicle to an individual? If you can't dedicate, then how do you deep clean a vehicle before the next person then takes over it? How do you change how people work in proximity with one another? How do they move around the environment? How do they move through the work shop, for example, and come in contact with other people or surfaces and such like? Can you do something really as simple that in the very least you can do is getting people working back to back, so they're facing in different directions? So there's a whole host of things possible around job design which will help us to be able to think that through. Secondly, we've got use of buildings. So from a use of buildings point of view, think about rest areas, canteens, stairs, lifts, hot desks, communal equipment such as photocopiers, where people are using the same keypad and that sort of thing. So think about those kinds of things. Think things creatively, laterally, about how you might approach some of those things. So the difficulties in lifts, for example. So you're in a multi-story building, the only access really conceivably is up and down through lifts. So what can you do to reduce the pressure on that environment? Well, first of all, think about half of your people working at home one day and the other half in the office, and then swapping over the following day, or a third today, a third tomorrow, and a third the day after. So think about reducing the number of people that are in the office. Think about staggering start and finish times. So everybody arriving at 9 o'clock and everybody leaving at 5, or everybody leaving for lunch at 12. Not going to work. So why don't we spread it over a 2-hour period? You arrive between 8 and 10, and you leave between 4 and 6, and your lunch break is between 11:30 and 2:30, or something of that nature, so that we can stagger people moving through the environment, and that will help to reduce that pressure. Hot desking in particular, really key problem. How do you have people there sitting there, possibly passing contamination from their hands, possibly passing contamination because they're speaking on phones and that sort of thing. So how do you sterilize a hot desk before the next person comes along to use it? You need to think about that in your cleaning regimes. So number 3, planning. And number 3, think about your business continuity plan. I'm sure that it's been severely tested by this epidemic, and you've got lots of learning to think about and incorporate within it. As we go out of the easing of lockdown and into normal working again, there is a potential for a second wave of infection. So it might well be that we need this business continuity plan to be once again utilised. So don't leave it till later. Think about updating it now. Thinking about where you're going to be with it if you need it. What happens if we do get a second wave of infection? We do lose most of our employees, we do lose key personnel, and so on. Make sure that those parameters actually are updated and will work for you. Number 4, identification, and by that I mean identifying people with potential COVID-19 symptoms. So there is a lot of discussion at the moment about whether you should take employee temperatures or not. And what do you do if you do find somebody with a temperature? How do you know whether that's a temperature due to the disease or something else, and so on? And how will employees think about their temperatures being taken? Will they be happy with that, and so on? What are you going to do if you find somebody with a high temperature? And also, how frequently are you going to test the temperature? You know, if viruses double in number every 20 minutes, you know, you could have a low level infection with no temperature in 1 hour, and then the next hour that person could then be exhibiting the symptoms in a very contagious way. So you know, where do you go with that? Well, you know, some people are going for it, some people are ignoring it. It arguably, for me, and it's a personal view, it's the least you can do, and it does give you another option in your tool bag to say to somebody, I think you're falling ill, I think you need to go home. And number 5, cleaning. So don't forget those focal points where everybody goes, everybody touches. Think about the frequency that you're going to clean those environments. Think about changing cleaning contracts accordingly and that sort of thing. Think about resources. So do your cleaners have enough resources? Have they got the right kind of fluid to decontaminate? So is it, you know, a bleach of appropriate strength? Do they have enough cloths? Because obviously, as you're using cloths in the environment, they're starting to get loaded with contamination. And think about the safety of your cleaners themselves. Now, think about this carefully, because what you are doing is you are sending them in harm's way. You are actually sending them to go and clean surfaces that you suspect are contaminated. So think very carefully about how you're going to protect them in their environment. So lastly, we get to personal protective equipment. Why is that the last resort? Well, for all sorts of reasons. It relies on people wearing it correctly. It relies on it being the right specification. It relies on it being kept clean. It relies on it being stored correctly. And what do people do with that PPE is really quite vital, and is open to so many misinterpretations, so many misuses and abuses, which makes it ineffective. So couple of things that people have been talking about, just to unpack that a little bit more for you. First of all, the use of face masks. Be aware, of course, that face masks protect others from you, not you from others. Also remember that because you're wearing it on your face, there is a tendency for some people to keep adjusting it on their face and so on, so their hands, which are potentially contaminated, are going to the facial areas. That increases their chance of actually getting the disease. If they have the discipline not to do that, then how often are you going to change that face mask? Because the more you breathe into it, and the more you breathe in that environment where there is potential and contamination, the higher the potential loading of contamination is on that face mask. So how are you going to dispose of it? Where do you put it? When you've taken it off, your hands are now contaminated. So do you then immediately ask people to clean their hands, and so on and so forth? So there's a whole host of things to think about in terms of just managing the use of that personal protective equipment, the face mask, in a proper way. Then when it comes to gloves, if you're wearing plastic gloves, rubber gloves, that kind of thing, first of all, think about the type of glove you're using, because some people have latex allergies and that sort of thing. But also from the point of view of gloves, they're still going to get contaminated surfaces. They're still going to touch people's faces, touch other surfaces, and so on and so forth. So, you know, what use are they actually doing in a non-medical environment is a serious question for consideration, really. I would suggest that, you know, hand sanitizers, washing hands, is just as effective, if not more effective than gloves. That's kind of where most of the advice is going at the moment. And I understand that people are getting dermatitis from using hand sanitizers a lot, and skin conditions and what have you. But there's nothing stopping us putting tables out with bowls of water and soap and you know, and replenishment water and all that sort of things, and hand washing stations. There's nothing stopping us putting bowls of water, bowls and soap and what have you in the back of vehicles for delivering to people's homes, so they can keep washing their hands. So there's all sorts of things in and around that we can perhaps think through that might be actually more effective than providing gloves. And my parting shot to you is this: in all of these kinds of controls that you might consider for COVID-19, remember, nothing is ever guaranteed in this, that there's always going to be a level of residual risk. And I urge you to be open and transparent with your employees about this, that you cannot guarantee their safety. You know, they could get it from home, they could get it traveling to work, they could get it within the workplace. Who knows where they got it? You know, you can't actually say where they might have picked up that disease. And all of these things reduce the likelihood, and reduce the likelihood significantly, but it can never reduce the likelihood down to zero. So I hope you found that useful. Thank you very much for listening to me.